Hi guys, Chris here from Active Health. I hope you're all keeping well. Here's a little clue about what I'm going to be talking to you about today. It's not homeschooling. In fact, it's vitamin D. The reason I'd like to talk to you about vitamin D is due to a recent webinar that I attended. It's highlighted a lot of the facts and research relating to vitamin D and in particular to deficiency in vitamin D, which I was surprised to hear is actually a large proportion of the UK population. In fact, research has shown that in winter time, possibly 90% of people are either deficient in vitamin D or running at a sub-optimum level. So if we can increase those vitamin D levels, we're going to see some really big health benefits. So what are common symptoms of vitamin D deficiency? So first of all, one of the most common ones, and we see this in clinic all the time, is widespread muscle and joint pain. And it's normally quite general. It doesn't necessarily, it doesn't benefit from treatment as much as we'd like. You can get low back pain with it, general tiredness, low mood, and another health benefit linked with optimum levels of vitamin D is an increase in your immune response, which obviously is of vital importance at the moment with the coronavirus circulating. So we all want our immune systems to be functioning at their optimum so that we are best equipped to fight off any viruses. So who is most at risk of being deficient? So elderly people have been shown to be, obese people have been shown to be, people who have darker skin, so the darker your skin is, particularly in the UK, then the most likely you are to be deficient, and people who just do not see any sunshine. Now, where do we get our vitamin D from? So moving on from my last comment about sunshine, the vitamin D is generally produced in our body through having contact with direct sunlight. So you do get a small amount in your diet, but the main amount comes from our skin being hit from the sun, and it produces vitamin D in our body. And did you know? So if I show you the units of vitamin D in this supplemented packet here. So each pill here contains 1000 IU, which basically stands for International Unit of Vitamin D. Did you know that 20 minutes in the sun with at least 25% skin exposed and no sun cream, that's important, can produce 20,000 units of vitamin D in the body. So compared with a small amount of supplementation like that, you can produce a great amount in a short space of time. So advice is, if you haven't been getting any sunshine at the moment, try and get at least 15 to 20 minutes per day, and as I said, it has to be with some of your skin exposed. No sun cream. I know some of you might be a little bit worried about that, but as long as you're only there for 10, 15, 20 minutes, your skin should be fine. Just judge it. Most of us know how much we can tolerate, so as long as you're not out long enough to get pink, then it's actually good for you. And once you've had that little bit of dosage, you can cover up, put your sun cream on, or go back in. And if you can do a little bit each day, then it's really going to top up your vitamin D levels and get you functioning at an optimum level. Now, what if you aren't in a position to go out, or you really don't want to expose yourself to the sun? Then supplements could be the answer for you. Now, I brushed quickly on dosage then, and as you saw from this packet, the dosage of this was only 1000 units. I had a little look at some more supplements that I've got at home, and these are cod liver oil supplements with added vitamin A and D. So if you've got something like this, you might be thinking, well, I'm getting my vitamin D from those. But if you look at the back on this one, the vitamin D, I don't know if you can see that. Yeah, vitamin D is only 200 units. So it's not going to be enough to make a massive difference in your general health, particularly if you're already deficient at the moment. So it's just not going to have any benefits in your health. So as a general rule of thumb to start with, I would recommend, or it was recommended, that you take a dosage of at least 4,000, or I'd say an average amount of 4,000, and that should be about right to at least give your vitamin D levels a bit of a kickstart. Now, 4,000 a day might sound quite a lot, but remember, your body can produce up to it can produce at least 20,000 units just in 20 minutes in the sunshine. So although historically people have been worried about overdosing in vitamin D, the actual research shows that you would have to take supplements of 40,000 units per day for an extended period of time to actually have any side effects, any detrimental effects. Now, the one particular one thing to make note on that is a disease called, or a condition called, sarcoidosis. Then you are at risk of having problems, and so if you suffer with that disease, then get more advice from your doctor about that. I won't go more into that at the moment, but otherwise, if you are in that category of people who are suffering with any of the symptoms that I mentioned, or you're generally in the high risk bracket, then it won't do you any harm whatsoever to top up in your vitamin D levels and at least get them into their optimum stage. So there's a bracket, that there's a range that is acceptable in terms of vitamin when they measure vitamin D, and often when you have it measured at the doctors, if that's the lowest range and you are here, just within the accepted range, then they say, well, that's absolutely fine. But research has shown that if you can get your levels up to here, you are actually going to benefit much more and be more healthy as a result. So I hope that information is useful to you guys. And if you have any questions or any feedback from that, then feel free to contact us on the Facebook page. I'm always happy to even have a chat with anyone if anyone wants to arrange a phone call consultation about anything else. As Pete said, we're here to help, and we want to continue to do so. So in the meantime, stay safe and keep well, and we'll be back with some more information for you soon. Bye bye.